patients has been so kind to allow me to video his journey towards getting gynecomastia procedure. Gynecomastia is basically male breast tissue that develops as a result of various different reasons. But in this gentleman, he didn't have any particular reasons, and he has tissue that makes him uncomfortable, makes him self-conscious, and he's thought about this for a long time. He's now in his 30s, and he finally wants to do something about it. And I want to try to bring your attention to what's going on over here. And he's got what some people say grade 2 gynecomastia. The grading system is really for us physicians, but for the purpose of what our patients suffer with is usually fatty tissue and then glandular tissue. Glandular tissue is basically a gland, a breast gland, and it has nothing to do with fat. You cannot suck out glands. You have to actually excise the gland. You can break it down, and that's why we use a device called Vaser to break the gland down and sort of devascularize it, so when it comes out it's safer and we can get much more out. Also, around and surrounding tissue of the breast and glandular tissue becomes very fibrous. Again, that's why we use a device called Vaser. Vaser allows us to extract fat and break down the fibrous tissue to take as much out as possible. You can see also, besides the fatty tissue and the glandular tissue, there's skin involved. The skin needs to be addressed. Sometimes, if there's a lot of extra skin with a device called Renovion J Plasma, sometimes we have to cut that extra skin. And it really bodes on whether that skin is a mild to moderate or a severe amount of tissue. And then there's also nipple positioning. Thank God, in his case, it's mostly gland and it's mostly fatty tissue, and his skin redundancy is very mild. And once we remove this tissue and do adequate amount of liposuction with Vaser, the skin above it will contract in a manner that he won't need any additional procedure. Last thing I want to bring to attention of anybody who's considering this type of procedure is to understand the scarring. If we want to do any type of procedure, there's going to be some scarring involved, and there's no magic to this. We try to, as cosmetic, as plastic surgeons, we all try to minimize scarring, but unfortunately, no matter what we do, there is going to be some scar somewhere that is going to be visible. So what we try to do is put it strategically in areas that we can, which is in the fold, underneath, and under the border where it can be hidden. And in his case, what we're going to do is first we're going to Vaser and break down the gland, and then we're going to liposuction using micro-air, which is a mechanical liposuction system, and extract all the fat below this line, and that's going to bring everything down. Then the glandular tissue, which looks like a little ball under the tissue, and you can see how big his gland is. It's really this size. I can actually palpate it, I can feel it. I'm going to go in and excise that gland. That's going to leave a bit of a crater. Then I'm going to mobilize the tissue around it and bring everything together to minimize that that missing element of gland that is over there, so it won't look excessively resected and there's no indentation. And at the end, we're going to smooth everything out and get out. Typically with this type of procedure, I don't put any drains unless there's excessive amount of that space that needs to be addressed, and then I'll put a drain. Or if the surgery, as we surgeons like to say, is juicy, that means there's a lot of fluid and small amount of bleeding vessels that we have addressed, but we feel like it needs to have a better control, then we would put a drain. Thank you for joining us.
Today we have a gentleman who's 32 years old and has been dealing with gynecomastia all his life, and he's finally want to do something about it and get rid of the excess breast tissue in his chest, and be able to wear the shirt and the clothes that he wants and go to the beach and be free of this issue. So what we're going to do first, we're going to liposuction the chest using laser technology. Laser technology is specific and it allows melting the fat away from the fibrous tissue and breaking down the fibrous tissue and devascularizing the gland. Then we go in and we cut the gland out, and then we repair the hole that the gland has created. And subsequently, we're going to smoothen everything out and come out. What we're going to do is we're going to laser liposuction and remove all the excess fatty and fibrous tissue, and then we're going to cut the gland out. Stay tuned. So this is what laser liposuction is. The tip of this device has 5 rings. These rings basically vibrate at a high frequency, acting like a little, almost like a tornado in the tip of it. It creates a vortex that melts away the fat and separates the tissue, and allowing for all the fat to be extracted without significant peripheral damage to the tissue. And that's why this is so useful in this type of case, because if you can see, the tissue is very fibrous, and to get those little blood vessels and the fat to be released, you will cause a lot of trauma. But with this device, you minimize the trauma, minimize the blood loss, and allow for the gland to be separated from its native tissue and to be excised in a safe way.
Like that, kiss it like that, making it last fast, bring it right back, wear it like that, move it like that, like it like, do it like that, kiss it like that.
So we have just completed the full liposuction, laser liposuction, and then we did gland reduction and excision, and then we close everything up, and you can see nice flat chest with excellent contour. You no longer see the breast tissue that was previously making this patient concerned. Thank you for joining.
Like that, do it like that.